Hello again from Atlanta, Georgia at the NACCHO conference. This is Sam Bradley with yet another episode of the Disaster Podcast. And we're actually discussing something right now that I think is of critical importance, and that is how we deal with some of our special needs people in a disaster. So I'm talking to Chaz Eby and Karla Black, and they're going to tell you a little bit about what they do in regards to that subject. So Chaz, you want to?
Yeah, sure. Thanks, Sam. My name is Chaz Eby. I'm the Chief Planner for Emergency Preparedness at the Maryland Department of Health and Mental Hygiene, and part of my duties are to develop preparedness plans for communities within Maryland and the State Health Department. And of course, within those communities, we do have a lot of vulnerable populations and people living with disabilities, and we do like to include them in those plans. So that's what I'll be discussing today.
Excellent. Karla.
Hi, I'm Karla Black. I'm the Emergency Preparedness Coordinator for the Kent County Health Department in Grand Rapids, Michigan. And I'm also an Emergency Preparedness Coordinator. And so I also too write plans for the community to make sure that we can recover from a disaster. And so we've actually been working a lot with our vulnerable populations to make sure that they are included in our planning.
So Karla, let's just start with you on that subject. How do you include them? What resources do you have in a general population full of special needs?
Yes, actually the County of Kent has over 500,000 people in it, so we have quite a few people that we have to plan for. So what we've done is since 2007, Pat Draper and Dana Porter actually formed a coalition called the Disaster Mental Health and Human Services Committee, and it's been going ever since. And so we've had representatives from long-term care facilities, mental health, a little bit of everything actually, and they meet every month and they discuss their lessons learned and how, you know, if they've reacted to something, that they share those lessons learned. And so it's just this kind of learning community that we have every month, and it's been fantastic.
Excellent. Good deal. Chaz, how do you, what special things do you do to serve your community?
It's interesting because states typically don't have direct access to residents, but what state health departments do have is the access to the people that have access to them. And by that I mean that the state health department, of course, has local health departments and local equivalents, and we can provide guidance to them and support them how they need for what they need to do to get out to those people that they need to get out to. And then the second thing that's really important is that we do have access to and can collaborate with associations and statewide or even national associations whose representation are people with disabilities or vulnerable populations. And then we only deal with the one or two associations, and then they go out and deal with their population.
And that's what I've been thinking about, all of the different types of needs out there where, you know, I've dealt with the deaf community, so you have communication needs, you have certainly the elder population, you have pediatrics, you have mental health. I mean, you have issues of people that should be on certain meds that aren't. That's a whole big element right there. So how do you find all of those resources? Do you have different groups that you would approach to come out? Say there was a big shelter that was put up to manage these folks?
Yeah, definitely. I mean, with our group that I already spoke about, I mean, that's how we operate. We actually had a flood last year, and we weren't having really good communication in our EOC, so all of our organizations that work together with us were kind of our boots on the ground, letting us know what our vulnerable populations needed at the time. So in a way, they were a hotline to us in the EOC, letting us know, hey, this long-term care facility is evacuating, or oh, and actually for Red Cross, they needed a specific type of bed for one of their shelters, and we were able to reach out to our committee and ask for it, and within 45 minutes we have 4 offers for that specific type of bed.
So a lot of it then is setting up your resources ahead of time and knowing how to tap into them. Jamie was talking with another group about informatics, so that would bring, how do you guys get your information on what the needs are out there, Chaz?
Well, the first thing is to have a great relationship with your local health departments, because we don't know anything unless our local health departments tell us it. And so that is absolutely first and foremost what we need to do at the state level. There's some new projects on informatics that we're actually doing now with the support of our local health departments. One of those that has to deal with some vulnerable populations is actually tracking healthcare facilities' power outage statuses. So this came about after the derecho storms in July of 2012, which were a strong series of storms that wiped out power for about 1 million customers in Maryland.
Wow.
Followed by a heat wave.
Wow.
Oh no.
Where it was at one point 116 degrees heat index.
Salt in the
across Maryland.
wound.
Exactly.
Yes.
And the problem is, as you both know, heat has an even higher impact on a lot of vulnerable populations and
Very
people with
much so,
disabilities.
yes.
So we had a planner, Jane Ellie, in our office who developed an online tool for tracking power outages given to the local health departments. It has a populated list of all of the healthcare facilities, nursing homes, assisted livings, mental health facilities in our state, broken down by jurisdiction, given to local health departments that they have on hand, and it's real-time situational informatics where they can set up a system to get that information from those healthcare facilities and just check if they have power or not. It makes situational awareness very, very easy, and the value added for a local health department is that we can then work with the utility companies at the state level and prioritize your nursing facilities, dialysis centers, any centers like that. So it's good.
Just feeling so smart learning about informatics. It's a term I can throw around now. But you know, the bigger the incident, the larger the incident, the more people affected. I'm reflecting back to the 2007 wildfires we had in San Diego. And that covered, I mean, when you're speaking about evacuations, that was a huge number of people. And fortunately, it wasn't an issue of so much illness and injury, just where do you put people? And so they were using places to evacuate folks to that weren't intended to be places to evacuate folks to, and there were people landing there that nobody knew about, and it was really a complex situation so I can imagine the challenge for people like you when you got the EOC put up and everything. How do they gather? Maybe you have better means of gathering that information now and really knowing what's out there and what needs to provide.
Well, and also, I mean, in Michigan, what we're doing right now, at least on our side of the state, is we're putting together MOUs actually with long-term care facilities that, even though they might not be in the same system, that they can actually transport their patients and have those agreements. And so that's been really new with us. And so hopefully we won't have to use it, but unfortunately, more than likely, at some point in time, it will happen.
So, Chaz, how do you exercise these plans? Do you involve these people that you have?
Oh yeah, we always like to include them. We leave it up to, as I said, either one of two methods. Either have the local health departments bring in the facilities within their jurisdiction, or go top down and get in touch with the associations that represent them and involve them. And we've had very, very good participation in the past because, let's face it, these people actually want to be involved. I mean, they realize that emergency preparedness is important. And in Maryland, there's actually some regulations, whereas they need to have emergency preparedness plans, they need to have backup generators, and they need to be able to have evacuation plans as well. So they want to be involved because they need the expertise from people like us on how to develop those plans and evacuation routes. So they want to be involved.
Definitely.
So we're talking about personnel needs, we're talking about equipment needs, and we're also talking about expertise. So you've got to find the right people with the right level of expertise, I can well imagine. Wow, that's a big nut to crack, especially if you have a very large incident. If you needed transport, say, and I'm thinking about the situation where you may have a whole nursing home full of folks that need some pretty regular care, how would you transport those folks to another place? And who would handle that kind of thing, Chaz?
Well, at least for us, evacuation is kind of always the last resort.
Well, true.
But it's something you need to plan for because it is such a major impact on the community, on the people within it, on their families, on emergency management, on the health department as well. So we're fortunate to have a very good working relationship with our state EMS agency. It's not within the health department. They're a sister agency for us in Maryland. And so they take a lot of the lead on transport. They, with us, coordinate how those resources are going to get there and how the transportation is going to take place. And we're just very fortunate to have a good relationship with EMS. It's very important for state health departments and their EMS equivalents to be working together on a lot of projects.
I totally agree. Similarly in Michigan?
It's very similar. It's mostly EMS, but also some of our specific agencies have buses for transport for their clients, and so there have been MOUs drafted to actually use those during it. And then also I know that there's talk using our Rapid, which is our metro system, to actually transport people if we really had to.
Yeah, because you got different levels. You got when you just need to move people versus when you need to get them to a different level of care.
Right.
So again, going back to the concept of having a huge evacuation site, once you get a sense of what the special needs are, you have folks that can go out there and provide those needs, sign language interpretation or pediatric or geriatric, whatever the needs might be.
Right.
That's really good. So tell us, Karla, how people would learn more about your process in Michigan, and
You can go
or
ahead.
just good information that they can.
They can actually go ahead and contact me if they like. My phone number is 616-632-7242. And so I'm more than willing to take phone calls, or they can check out our health department's website at www.accesskent.com/health.
And Chaz.
Well, we're fortunate. Office of Preparedness and Response, where I work in the Maryland Department of Health and Mental Hygiene, has a website, and we can take direct feedback there. It's maryland.dhmh.gov, I believe, or if you search for Maryland Department of Health and Mental Hygiene, you can get information there. Although we also now have a Facebook page for the Office of Preparedness and Response.
My next question. Yeah.
As well as our Medical Reserve Corps and Volunteer Corps as well. So we're able to be reached through social media now.
Yeah.
Well, we've had a lot of discussion about social media this week, and it's playing an amazingly important part. One of our guests here earlier had an event going on in her area that she had been tweeting all morning, so she was running between tweets to have this conversation. So even as we spoke, there was an actual event in place, and so the ability to get that, and I'm sure it works both ways. As much as you disseminate information out, you also get information in through that.
Sure. I assume that's why you took our cell phones before the interview. So
yeah, I was not going to let her.
I was going to post on
she was
Facebook
like,
that I
"Where's
was
the phone?
on here."
Where's the phone?" So I can't imagine doing that 24 hours a day, but I guess some people do. So yes, we're all a little hooked on that, but it's a good thing.
Yes.
No, it is. It's an important new method, and some people, that's how they get their information. That's the first place, the fastest way of getting it.
Right.
So
Well, and you want to get general information out to the public, and she
Right.
talked a lot about just, okay, we have a tornado coming. What are the things you want to know? Get your cell phone charged, get your medications, disaster kits. I mean, all of that information that you're trying to be proactive about letting people know. If it happens, you want to be as prepared as you can be, and unfortunately, not everybody is, but
Right.
you can try.
Exactly. I mean, we had a water contamination issue a little bit earlier in the year, and we did put out a lot on Facebook, a lot on Twitter, and it sounded like most people got the information from those media types, and so we've been trying to use it quite a bit.
And one of the points that they made earlier too is knowing you have credible information,
Right.
knowing it comes from you, that's the information people are going to look for, and that's the information they're going to retweet out to people they know. Because there can be a lot of misinformation out there, and that's not what you want to happen, and have people panic and do the wrong thing. Would I agree?
yeah, absolutely. I mean, it's really important to have that one message coming from the authority on the issue,
Right.
and you can use social media to do that as well. Social media is also good for it's crowdsourcing information, so you can see the direction of. You almost get a feel for. It's only 140 characters, let's say, but you can kind of get a feel for what that is.
It's
just
amazing
based
how
on,
much you can actually communicate.
That's for
We've
sure.
gotten pretty good at doing that.
Yeah.
But social media is a wonderful thing, and you certainly can use it in your disaster preparedness efforts. So we commend you for that. Well, again, another subject we could spend a lot of time on, and I wish we had more time, but we're kind of winding down here our week in Atlanta. It's been a very nice week here in Atlanta. We appreciate NACCHO bringing us out here and giving us the ability to disseminate this information out to people. And here we are, the end of the day. So this is the Disaster Podcast. This is Sam Bradley. We appreciate being here, and we leave you with the final words that disaster medicine is not everyday medicine, and disaster preparedness is everyone's responsibility.